they've got to be generic across the board, but provide what support they can. And then obviously they'll probably then filter that, flag that up to the clubs. Like I say, it's not a massive thing, but it just springs to mind as in who's responsible. Their governing bodies can help drive that into the clubs, I think, particularly clubs with minimal resources.
I would sort of say football in itself has got the FA as a governing body, Premier League and the EFL as the leagues, PFA as the union. The bringing together of these organisations in the strategy group brought together by the Premier League has been really useful. I think sometimes where there is a provider, other providers have been there adding to the conversation. I would think, and my question would be really whether sometimes in a club it feels like mental health or services are something that are done to you, and actually engagement of the clubs in the conversation. Even though I would totally agree that we need standards, we need audits, we need all those things, that actually I think part of the other interesting work the Premier League has been doing is engaging their clubs in the dialogue, captains meetings, players meetings, because I don't think, even though there needs to be responsibility, I think if the Premier League or the FA say we've got to get away from this is something that we are going to impose on a club, it's got to be a joined-up process that works together.
It comes back to one of the things on one of my slides, though, where I feel that who deals with mental illness mental health issues on a day-to-day basis at all our clubs, because I don't know how much we can say, well, it's the PFA's responsibility, this, or it's the FA, or it's the EFL. To me, that's just passing the buck. And I think that the clubs have to take a lot of responsibility themselves. And I still question why some clubs will not fund, as I say, basic medical support. So are we just, talking into the breeze about this? Are we seriously going to address mental health issues when they can't address basic medical support? Because I would say at most clubs they will have a general practitioner. That general practitioner will see mental health issues day in, day out. That is part of their job. Yet they probably aren't funded or aren't consulted as to necessarily how those people can be managed at a football club.
I'd agree.
So with that, I mean, would we see, again, as a consensus of the audience as well, would we suggest that actually the medical department should be the ones that are driving this, or is it responsibility from board level, as we say? I mean, or is it directives that are coming in from outside sources? What's anyone's opinion?
I think there has to be some responsibility for the board. I think there is a hub of expertise and experience within the medical MDTs, but I still stick with Tammy Gray-Thompson's an adult person. I, as an employer of Sporting Chance, should have the right to go somewhere else and talk about my mental health and my physical health. That can be private to me. My mental health is not the ownership of you, the club. So I should also, even though it should be looked after, I still have the right as an adult human being to access help away from my employer.
But when you're 12 years old from a very deprived background and your parents are divorced and you're getting emotionally and physically abused, those are the issues that we need to deal with as well. Yeah. That's the reality of the developmental phase that to me is so important. Once you're a professional, established professional person, I'd agree that slightly changes it.
The word I used was adult.
Yeah.
I think within the academies, I think that actually duty of care is a really interesting subject. And actually I think duty of care quite often is, sometimes the ownership of duty of care is sometimes taken on by clubs at the expense of parents and other structures. So I believe there is a responsibility there, but duty of care is a really interesting subject as to who is responsible for a child's mental health.
Can I just follow up on that? Sorry to jump in, but so I think that it's a misnomer to believe that an 18-year-old has capacity and is fully developed neurodevelopmentally. We know from research, from neuroscience, that actually in the modern era, it's kind of mid-20s when people are properly maturing in terms of their personality, their understanding. So whilst legally, you're absolutely right, Colin, I think there is a bigger question about what about young adults. And if you look at the way psychiatric services are being remodeled now, you're not having that fixed cut-off at 18. In the NHS you are, but in the private sector, there's this kind of young adult, this developmental view. And I think that on the point about accountability, Brian nailed it by saying accountability has to be held by those who are in a position to take the responsibility. If you think about other workplaces, it will be board members. Board members have the responsibility to provide a safe environment within which to work. This is a health and safety issue looked through one lens. And so my personal view is that it has to be the clubs, it has to be club board level buying into this, supported by all the other stakeholders and funded appropriately by the stakeholders that are in a position to do so.
Okay, I've got a couple of questions, one in the back and then... Oh, sorry, I was going to go to the back. Go on, whichever.
Nick, we know each other well, so I'd like to just pass over a couple of opinions and see what people at the front actually think. I've been done about 25 years in the business. What I found was that with the issues that I dealt with, and I had really in 25 years 3 safeguarding issues only. I wasn't a safeguarding responsibility, that was down to somebody else. But I find myself picking up on something you've just said there, Colin. The first thing is that I always found the word welfare tagged onto the end of a job description as being a real issue. And that being, first and foremost, that somebody would turn around and say, go and see Pete Lowe, that's his responsibility. Duty of care is a mindset which creates a load of actions. And unless there's a mindset, first and foremost, to accept duty of care as your responsibility, not just one person's, then that will never actually go away inside of that club. The second thing is what I think is a bigger issue, and it may well be that, Brian, you've got a real point on this because you're a doctor inside of a club and probably see an awful lot, is that I think the big problem for clubs is what I call disassociation between the levels. So you've got an academy level and you've got first team level. Unless there's a culture which runs from the top of the club, which operates no matter what happens inside of a club, in other words, when people change and managers go out, managers come in, bring the friends in, etc., then you will never have an operating procedure towards people's needs. What are your opinions on those two things? Sorry, there's a lot there. I apologise.
I totally agree with your first point, at least, that actually when things are added to job titles and there's go-to peoples, it seems to other people abdicate from responsibility. And actually a system responsibility or duty of care, I think that would be a great goal. I agree with that.
I think your point's right. When the EPPB came out, it was heads of education and welfare. It's now being streamlined. I believe the Premier League are driving it initially with Cat 1 clubs. That it's a head of education, one role, head of welfare, separate role, or player care is the optimum title these days. I think then when you bring psychologists, you are bringing in a bigger, better support network than there's ever been. Safeguarding, to go off another point, is now at board level. Every chief executive or member of a board makes the final decision on a safeguarding policy, safeguarding practice, safeguarding referrals. That goes at board level now. That should be happening across all clubs. I think the point being is that perhaps this event today needs to drive that mental health issues need that kind of backing as well. I think that if safeguarding can be, if health and safety can be, if an operation or a treatment of an injured player, the board make the decision on the costs of that if it's outside of the insurance or something, why shouldn't mental health be put in the same way? Well, it should be. And I think that's perhaps something that needs to be driven on the back of this.
I think in terms of human behaviour and encouraging culture change, responsibility taking, the reality is, it doesn't matter where you work, your life is overloaded, there's too much going on, and you're going to have to fight for prioritising different areas. My experience in sport and outside of sport is that it's tragedies that drive culture change, or at least people signing up to do things in a different way, often suicide. And board members of organisations and people, particularly within cricket, where the suicide rate is very high, at an early stage recognised the vulnerability that they faced. And we have to be honest, at the end of the day, these are businesses operating to make the bottom line work, to have a successful product. They don't yet recognise in any sport that the investment in these areas will actually, in the long term, not immediately, in the long term, will pay back dividends. What I would hope is that through a process, and I loved your suggestion about the coaches being the kind of lead contact for mental health, but I think that'd be an amazing utopian achievement. But what I'd like to see is that there is, through the process of these conferences, discussions, going away from here and talking actively about this, that there is that beginning of the discussion and the culture change, allied to some very clear, being brutally honest. If it's health and safety, if it's safeguarding, mental health is in exactly the same bracket. So if it's recognised at board level to be their responsibility, it is already, and that just needs to be explained.
I think I do agree, and I mean, I know in other sports that, head coaches are definitely a major influence within this. I think one of the other issues within football is the working lifespan of head coaches and how long they are at clubs, and the turnover of head coaches, because actually you might wish to adopt that. So the most stable part of a club is not always the head coach.
Absolutely.
If you see what I mean, the head coach's change. I don't actually know, but I mean, at some point, the lifespan being the wrong word, but the career lifespan of a head coach and how many head coaches a club can have is not stable enough sometimes. So there has to be a wider responsibility, perhaps.
The average is 11 to 13 months over recent years.
Yeah.
In professional football.
Which is hard to change a culture within that period. Yeah.
We had a question. Yes, sir.
Can you hear me?
Yeah, just go for it.
Anyway,
It's been a really good discussion. But what I'm sort of toying with is that you talk, to some extent, talking about mental illness in the individual. So the justification of, say, mental health is based on all the examples have been given about individuals and how they've dealt with it, not dealt with. My question really is, if you think about the idea of mental health, there's also the mental health of the team itself. So I'm just wondering whether there's any work being done in relation to the team and the team's mental health that the individual is part of. Because on the one hand, you take the individual out of the team and you rehabilitate them in some respect, they still have to go back to that team. So, it's the concept of the team's mental health is also important. Just wondering if there's any work that's been done around that.
You've been doing some, haven't you?
I would agree with you. Every organisation is an organism within itself, and the wellness of that organism will reflect the wellness of the parts that make up that organism in some respects. So I think, once again, some of the work being done around structures and culture that then breed healthy mental health is really important.
Yeah, just going back I was really impressed with the way Gareth Southgate ran matters for the World Cup, not on the field, but off the field, and some of the things that were alluded to earlier were very impressive. He attended a seminar one of my colleagues ran about 5 or 6 years ago, and he's obviously someone who's sufficiently insightful, has been there, understands the challenges to be able to embrace that. What you do need in the team environment is individuals of influence who can create that atmosphere. The other end of the spectrum is terrible. I referenced a few managers who, they don't want to even see that a player might have mental health problems. The reality is, even with full recovery, having a discussion and an open culture in those setups is very, very difficult. So if we can get it right, it makes a big difference. When we get it wrong, it really is a very negative factor.
Okay, we have another question.
Is this switched on? Yes. Okay, I've really enjoyed everybody speaking today, and everything has resonated with me on many levels. I'm a trained degree nurse and a psychotherapist as well in practice, and I understand the culture that football is obviously presenting and the limitations essentially that are being represented within the group today, because I'm very aware that it's a very male-dominated sport and the statistics are incredibly against men in relation to mental health. So we're starting off with essentially an uneven field, as it were. I guess what I'm hearing is that there is always this early intervention requirement in order for us to address mental health issues, and yet when we talk about players, we're talking about the 18 to 25-year-olds as being in the highest category of mental health issues, and the age and stage of that particular age group developmentally is another risk factor, because we don't come forward with mental health issues because we are scared at that point to create a stigma around our identity. I guess the question is a very long-winded one, but it's how you guys essentially can address this very fundamental biological issue, which is age, stage, developmental and culture. And I'm really hoping that we can have a discussion around this, because obviously this is why I'm here today. Thank you.
Well, I'm happy to start. I mean, I think my experience over the last 10 years working in this area is that there have been huge strides made in education settings to put within the PSHE curriculum mental health, resilience, and these topics. And what we're starting to see is a group of younger men, younger adult men, coming through who've been exposed to this, who are actually, I think, more able to have that conversation and recognise it. So I think there are some great things happening in society that are starting to tackle that particular factor. That neurodevelopmental age will always be a risk factor. That's never going to go away. You know, we're not going to change people's wiring, at least not unless social media kind of gets completely turned around. But I think that I think I'm encouraged by what I'm seeing in terms of general education, and we must accept that while sport can be a great opportunity to spread positive messages and encourage health seeking, these responsibilities don't just sit within the sport themselves. They sit with parents, they sit with education and wider kind of bodies.
I guess I'll pick up as the HE representative. HE is littered with a significant problem in relation to mental illness for all groups, but particularly for young men. And one of the reasons why we say that is kind of around 6-7 years ago at our own university, we not only identified the problem with students being students at 18 and so on, but actually in sport you could use sport as a mechanism to get young men in particular to talk about some of the issues by depersonalising a lot of this. So one of the things that we begun to do was to introduce something like mental health first aid. It's by no means a silver bullet, but it was an opportunity to have a conversation. And we do that routinely now for all of our students in sport. And we think that is important. In some cases, for those who are interested, we do suicide alertness and suicide intervention work. And actually, that was one of the key drivers for why we tried to establish Europe's, to our knowledge, it's only the only one in Europe, a sport, physical activity and mental health postgrad course, which we run in collaboration with Everton. And some of those things from the HE sector have now transferred into some of that work with Everton around mental health literacy of the team and of the organisation. So some of the things that we'll do, and I should say that this is coming from support at the very top of the club, and we're very lucky in some respect for that. Is about how do you develop in an organisation mental health literacy. You're not expected to be an expert. You know what your boundaries are, but you can have the conversation. What are some of the signs and symptoms, and some of the things that we've done now around not just mental health first aid in the university setting, that then gets translated into the professional club setting. So some of that we'll now do some of those things with the club staff, whether they're volunteer coaches, community coaches, whether they're people in HR. We talked earlier around where does the accountability lie. It has to come from the top of the club. And I think some of that support internally has been critical for certainly for some of the younger guys there, but also in the totality, the younger people in the organisation. So, it's not, as we said earlier, a silver bullet by any means, but there's certainly a recognition that a lot of the at-risk groups, and we get a lot of them at university, they come to us sometimes as damaged goods, and these are precisely the same times, particularly when they're in academies, in the 16 to 18-year-old category, they're precisely the times at which some of those risks, the initial risks for adult mental illness are beginning to kick off more generally. And for us, it's really been a conversation starter. And I think the young men in particular becoming more and more mentally literate, in a sense, and a bit more willing to engage in that. That brings its challenges, though, because actually it gets people to become more aware sometimes of how mentally well or not they are, and then that might bring substantial change. So we've noticed more and more referrals, for example, to our in-house counsellors, more and more conversations around suicide. I had one conversation yesterday, and we'd say this around our own stuff. How do you deal with students who present with that? So I think it's part of the education, but what do we do in raising that awareness and destigmatising? Is a service there to support people.
And given that they're so socially isolated because of their connection with digital media, do you educate them through digital media, or do you do it face-to-face? Or do you do both?
Both, to be fair. Some prefer it in kind of relatively small settings like this. in peer-to-peer. I think when it becomes destigmatising, a lot of peer mentoring. One of the key things that we do on our programmes with Everton is actually peer-led. It's not old people like me going and telling them what to do, because I'm becoming more and more invisible each year. But actually, when you get a peer mentor or a student who's prepared to speak to others of a similar age, and they will listen. It's traditional social work and youth work, really. It's nothing particularly new at a cultural level. But I think some of the things in terms of the social media as well, part of the isolation, it gives them a space to express those ideas. But also it can also be a space in which they begin to present a lot of the symptoms, and how do you manage that? And I think you see that in lots of settings. And we've certainly seen that. We're speaking to some of the young players in particular, where they may disclose at 2, 3 in the morning that they're not only having poor sleep, they're in pain, or they're having suicidal thoughts, depressive thoughts, and how can you trigger and manage that?
Can I just add to that? I work in private practice, and my work is a lot of the time with young people online through digital chat and platforms, and I have an anonymous chat group. And actually, a lot of the time, it's about bearing witness to expressing your feelings, and actually through that, there is a lot of credence, and the therapy goes on within the early intervention setting. So actually, there is no need to reveal the person's identity, because they're retain their anonymity, which actually is part of the therapeutic work. So there may be something that you can take from that, which is actually at signposting level in clubs, perhaps players need not to be contained within the club, and perhaps by outsourcing and allowing them that freedom to be able to go and speak outside of the club and have that facility, that might then help facilitate mental health.
One of the, good news and bad news really is we're finding a lot of players accessing services younger and earlier. That has improved greatly. One thing that I think is still, I believe that is not going so well is the cultural makeup of the group that access support does not match the cultural makeup of the playing population. It does in other sports that we work with. But a high percentage of players that access support through us are white British. So I think that there is still work to be done there for us. We are very aware at elite level that multiple languages and having therapists who speak the first 5 first languages is really important to people as well. But we have not got that right. I don't know, either as an organisation or a sport, we have not got that right yet.
How do we change that, Colin?
How do we change that, Michael? We work in...
The reason I said that,
yeah, I think...
right out of my mouth, because I was going to say, we're in this football adult population, the majority of our players are from different countries. So, what are we doing in regards to, and obviously their first language is English, so what are we doing, how are we supporting them to make it as comfortable as possible, that if they've got an emotional problem, emotional issue, that they feel comfortable enough to come forward and share whatever's going on in their home language. I think that might be a barrier that we've got to look at.
I think it's not only language, though, Michael, it's also culture. As I say, the language thing, I think there are some obvious things we should be doing, like making literature available in other languages, making sure that education is provided in multiple languages, making sure that apps can convert to first languages. All of those things, I think, are important. But even the cultural makeup of black players whose first language is English don't make up the percentage that black players' first language is English that are playing football, that are accessing support, whereas in other sports it does. And I'm not sure. I don't have the answer. I wish I know. So I'll work with you on that.
Yeah.
Sorry.
I think basic human qualities of empathy and trust are getting a bit missed out here, because we're talking about setting up apps now, and I take your point, it is part of the modern day world. But if I was to, I would say to someone like Andy, who's working in the Premier League, right? Okay, let's deal with something that I feel that you could help us with the Premier League. Now, not everyone's a category A academy, so do excuse us for that at the moment. But when you come and do your next review, to see can you maintain your status, and I'm sure you'll help us with this, perhaps, you know, the quality of the, or the colour of the plastic on the AstroTurf pitch is not as important as an issue such as this. But it's very easy for clubs to skirt around and make out that this area is being addressed, but maybe you will find actually it's not being addressed. And I feel if your organisation, which are involved in funding, and that's a big issue with regards to this, if they were to say, we want proof of what your system is, because you'll start to see many, many clubs, which of course when you work in one club you don't, you'll see what best practice is. And that is the kind of practice that we will fund. And if you don't have that, then you lose your category A status. That there has to be a change somehow, and if it's as a knee-jerk reaction to lack of funding that makes people go, right, well, we have to have that, we then might start to see really good pockets of practice. Because, again, last 30 seconds on this, but I just feel if we get the players on board with what is important here and get away from this the stigma thing, which should all be gone by now anyway, but hasn't. Get the coaches, get all the support staff. I would want a physiotherapist working on my team who didn't have empathy. In other words, oh, doc, here you go, it's a problem. They're a bit depressed. I'll leave that one alone. Not the kind of person I want working in my department. I want that person because they are first line. They may be the best person because that player trusts them. Might not trust me so much. So they might nail that straight away. This is what I've learned a lot from counsellors, that we all have skills inside that can help us first line. Now, if it doesn't work, your whole cohort of staff, well, it then goes up to the next level, which might be the clinical psychologist at your club. If that doesn't quite work, it may go to the club doctor, who then decides to refer on to something Cognacity. But there would be at least a stream. And I wager that 95% you could potentially get rid of the, I don't mean to be cursory about it, Phil, but of these sort of issues of the depression and anxiety. If people feel at home, there's trust and there's empathy within their environment. And I feel that's where people are getting lost with this. And they're not getting empathy and trust from a computer face, are they? No. And mustn't devalue those human qualities from the whole team. So that's why I agree with you. From 18 to 25, we still should be working at them on a daily basis, in theory. Yeah.
Okay. Do you want to ask a question?
Is this on? Oh, here we go. Okay, I've got two questions. Probably linking into what you were saying about more around clinical psychology. So I've worked at an academy now this is my 8th season. We went from a 3, category 3, to a 2, and we potentially maybe go into a 1. I couldn't decide what doctorate to do, because I feel like since when I started and there was very little discussion around psychology, how players felt, or even what was it, to where we are now is obviously significantly increased. And I feel through that process we are being exposed to more clinical psychology, maybe what could be deemed as more sensitive disorders and issues we need to tackle. But if you look at the educational framework for either a sports psych or a clinical psych, for example, sport, you need a 22-hour placement in a sport. Clinical, you need a 22-hour placement in an NHS setting. A lot of them are part-funded with NHS setting. Actually, there's a big gap in the education. One of my best friends is a clinical psych in Hertfordshire in the NHS, and what her week looks like and how she expects to work with clients is drastically different. I think she'd struggle in sport through the culture, squeezing things in, a weekly schedule changing, etc. So it's easy to say, we need clinical psychs, but if I think bringing my friend in at the top level that she is into our sport environment, it would not necessarily be easy or successful. So how do we go about getting the BPS, bases, or, anybody else to think about a potential sport clinical psych role? Is that?
I'm happy to start on that. I mean, there are a very small number of extremely well qualified clinical sport psychologists in the UK, in fact globally. So these are people who have got chartership in both clinical psychology and in sports performance psychology, and they're rare as hen's teeth. I go back to my earlier point about we all started out as generalists. So you say if you dropped your colleague into that work environment, she would struggle. Likewise, if you went to work in her place. But psychologists have got sufficient core skills to be able to pick up on the work environment and the culture. When I started working in private practice, I really didn't know that much about professional services, banking, law, accountancy, management, consultancy, that kind of approach. But you do it for 6 months, you do it for a year, you speak to the people, you hear what's going on, and you learn it very, very quickly. So I think that because funding is an issue, probably one model that could work is where clubs geographically link together, cluster, And you don't need a whole full-time clinical psychologist. You know, a day a week might be enough working with other members of that team as a sort of triage point to look at what's going on as a starting point. It doesn't have to be, you know, inordinately expensive to start with. And from your own personal perspective, what I would suggest you do if you're interested in this area is just look at courses. You know, there are relatively affordable short courses which might gear you up in terms of cognitive and behavioral neuroscience or cognitive behavioral coaching that can then enable you to have a kind of a broader ability, because just like Brian's model of having coaches who are sufficiently emotionally aware and skilled to do that kind of work at grassroots, you're in a brilliant position to be able to upskill that.
Okay, can I just have a second question really quick? Probably to Andy, is we obviously have this great provision at Category 2 and we're building on it, and I'm fortunate enough to work with people who are really innovative. The guy I was with earlier works for our first team, and they don't have a great deal of provisions, and what I see is academies were so focused on, do you have this? Category 1, you need a full-time provision, sports psychologist, you have a head of education, all these roles outlined, and then a player can jump to the first team and have nothing, which is where we maybe then rely on external services. Is there any discussion, and this is a massive question, but is there any discussion of a way we can standardise the level of support first teams get or have to have?
I think it's certainly been discussed and an ongoing topic. Obviously, at the moment, we're still waiting for who's going to be the new chief executive as well, and part of that, again, part of those bigger decisions from a first team perspective. I mean, probably the rules and regulations are, you would say, loosely, you would say they're tighter around academies than first team, and part of that has to do with the funding elements of what we give based on categorisation status. So therefore, you've got a little bit more jurisdiction on that sense, where you can say you must have these rules and provisions in place. At first team, we probably, you know, like we said before, we want to attract the world's best global talents and different associations, managers that come in with their own structures and whatnot and provisions. So probably the access around that's a little bit looser in that sense compared to the academy, where we can be a lot tighter. But there are ongoing discussions in terms of what the provisions are moving forward and what we need to change.
I'd say, and it's kind of, I've almost interjected a couple of times, is that the academy is the thing that remains consistent at the club. More than anything, the managers to and fro every 13 months or whatever the statistics are. The academies generally have an academy manager that is there for a long period of time. The culture is built. The aim of every academy is to get players into the first team. When those players go up, they know they can always come back. Then we got a lad out on loan at Oldham at the moment. Every time he has a day off, he comes and has a chat. We can talk about anything and everything. Doesn't have to be mental health, can be anything. But he knows he can always come back to the academy and speak to the staff and have a chat. And regularly it's me, because on his day off, which will be a Wednesday, I'm in. So I think clubs can make it better, is that it goes from top to bottom. And I think the new audit process is so much better. I think the EPPP was necessary to standardise things and get things in place. But to have the duty of care as the first thing before you can even move on to a compliance, health and safety, safeguarding, mental health, of which should be included medical provisions. Box that off, every club have that to the right standard, move it on then to the next set so you get your final categorisation. I think the culture of the academy is set within a club. That for me relates to what the club is about. Our club is very family orientated, always has been, was like that for many years under the previous owners. So some might shake heads. That's just my opinion. If the academy has that set, those first team players, whether they stay at your club and can speak to that staff or can build a relationship with first team staff, or whether they move on to another club, they've always got that person to come back to as a, who do I go to, can somebody help?
So for example, we've got quite a public knowledge player that suicide was in the press, it was really prolific, joined us in the summer maybe, with the first team, and as a club we actually didn't have to, you know, he came with his own personal network support, fantastic, but if he didn't for whatever reason, and as we all know, often people who need the support don't access it for their own personal decision, when we don't have to actually do anything about that, and with the managers changing as often as they do, a little part of me was the only one of psych as well, but was across everything. So it actually underpins everything about leadership, board level. So it is important at every level. Why is it so difficult to make managers at least jump to one formal tune when they join a club?
Yeah, I think, and I'll probably refer to Brian here in a second as well. I think sometimes, and probably coming from a club side, there's a huge amount of obviously issues that have gone on in the past that just we don't really know about. It's confidential and it's managed appropriately at that appropriate level. It's confidential if they're speaking to Sport and Chancellor, if they're speaking to the primary care, if the sports medicine doctor or whoever it may be. I think there is. It's sometimes we have this, we don't have any action plans in place, we don't have any emergency mental health action plans or anything. I think there are processes in place. They might necessarily be documented, and it's about this. Hopefully this process can help get it a little bit more transparent for everybody to see. But there are, like Brian said, he deals with issues on a weekly basis that are ongoing, and it's just probably more from a confidential point of view that information is not necessarily disclosed.
Okay, thank you. We'll move on to Paul.
Yeah, thanks, Nick. I was just going to mention the fact that I work with the Premier League academies over the last 7-8 years now, and certainly working with coaches. Lots of the academy psychologists, they'll work to empower the coaches to be that first line of support in terms of mental health, being aware of that, being that support mechanism, creating that environment where it's okay to speak about these things, to be open, to be transparent. But at the same time, the coaches are struggling because they realise, and we know that how hard it is for players to make it in the professional game. Potentials are so low at the top end to get into somebody's first team. It's so difficult, the amount of players that are leaving the game. So it's getting that balance right of being attentive to create that robustness, to create that resilience in a player, but at the same time manage the mental health of that player and get the balance right in that regard. And I think we're not really addressing the heads of coaching and the coaching per se to give them that skill set, to recognise that. At the same time, Brian, you mentioned about having that trust in your staff, doing your due diligence to ensure that you're bringing into the environment the right people, you're creating the right people, the right environments. And from what I've seen, there's lots of things that are going particularly well. There's still lots of room for improvement, don't get me wrong. But certainly, for me, a biggest frustration is still that void between the first team and the 23s and the academy. Mike talked about that culture. 1 minute you mention club, then you mention academy, and there's an inconsistency there, because it's not always club down. You talk about being club down. Clubs have these mission statements that are all flowery and say the right things, but it's for the academy down, and often the first team do not attend to the same values, and there's an inconsistency there. And it's often the first team managers, these really present, media attentive, powerful people that are not having these conversations. If it was a Pep Guardiola, Jurgen Klopp talking about mental health as openly and commonly and every say third or fourth TV conversation on Match of the Day that we're mentioning about these, it would become commonplace, and that stigma would dissolve even more. That's not happening. So I still believe we need to hold the first teams accountable, because you've got sponsors and everyone's strong and winners, and you've got to be this type of person to be the best of the best. And we talk about best practice, but actually we can still filter in the right language if we're able to make sure, because the boards say they address these things, but the board is someone out of the way. You don't know who the board is. Who are these people? But if it's come through the board and into the first team manager, and they're given that platform and held to account to speak about it. I'm not saying that Jurgen Klopp and Pep Guardiola, as two people, will want to be those ambassadors, will feel that they're comfortable to be able to speak about it in that regard. But if every single Premier League club and the managers are being held to account to at least speak about it more openly and to make the time to do it. Often we see player liaison officers that haven't got the time to do this. That player can't come to that meeting because he can't make the time for it. And all the time, we're talking about these things, and there's great things that are taking place, but it still gets stuck. And you mentioned about that until something drastic, terrible happens, no one's going to be held to account. And it's still going to be, sad as it sounds, someone taking their own life before a club puts people before brand, before money. And that's the elephant in the room, and no one's prepared to challenge that, because you can even have academy managers and directors saying one thing and their own shareholders saying something different, because there are other factors. And we talked about academies. For some clubs, academies are huge about bringing players through. But at other clubs, the academy is a tiny part to their football club. So it isn't held in the same regard as others. So there's things that we need to address, but we need to challenge the whole environment to affect change. These conversations we've had over the last 4 or 5 years with far more intelligent people than I, but it still gets stuck because we're not addressing it and we're not challenging it, and it doesn't. If it becomes a rule, then we can make a change. But sadly, it will be someone taking their own life before these powerful people become ultimately accountable.
Spot on, Paul. Yeah.
I mean, I'm happy to respond to that. I think that there are a couple of problems that get in the way. So one is the short tenure of these very senior influential managers. The other is that, because if you look at the work that the League Managers Association does, they are tackling this area. If you want to get your pro license now, you have to attend courses within which there is a resilience module built, which is currently delivered by my team, which teaches individuals how to manage pressure and stress for themselves, and flags up a number of these things. I said earlier, Gareth Southgate was one of the attendees of the first time we ran that. So when you get people in the room and they do the work, they do pick up on it. The difficulty is a lot of the high-profile managers are super, super busy. They may have an interest, but there's no leverage to get them to attend on this. That's where boards could hold an employer manager accountable. The mirror would be in the city, where you've got someone who runs a very successful department of a big business, but where they've had some kind of problem. Well, they're going to be held accountable by the board. So there needs to be kind of an approach from top down, in my view, if you really want to sustainably change the culture. And it has to start with individual resilience. You have to teach managers how to look after themselves, because, and we heard stories all afternoon about reactions that are really unhelpful around players, and the way in which managers or coaches can approach a situation and drag a physio into a room and say, if you've got a problem, don't go and see this guy. I hear that story, and actually I'm more appalled at the fact that that individual manager cannot manage their emotions. That's the problem there. It's not to do with kind of behaviours, it's to do with their inability to self-regulate, to recognise what they're doing and continue to act in a destructive way. So for me, that's where the behaviour change should be targeted, and that will facilitate, over time, culture change. But like all organisations, unless you get in at the top, people below just look up and say, well, why is this being done to us? Unless it's being kind of modelled and led, it's very difficult to get it to stick.
Thanks very much, Paul. I thought you spoke very well there. I just wanted to say about the, let's not as well forget the people that don't even get through. You know, the 90% of footballers at an academy that disappear off into the sunset, and who knows what happens to them. So we've got a chance. But also it's the fact, I view it my responsibility, Paul. I need to let the board know, and I know, you comment, who are these people? I know what you were saying. But I need to let them know, look, we need this resource. You know, I can't say, well, the money, the club can't afford it, unless they've turned that down. You know, I have to say, but this is what we need, and this is why. And if they say, well, we're not paying for that, that's okay. The accountability then falls with them, because that's why they're on a board of directors.
I think I would agree. I think the other thing I would add that Phillip mentioned earlier was, if this becomes a performance issue, if teams start winning or players start playing better because they are well, that's the other end of that we'll see a big change. And the other thing I would sort of say is, even though starting at that end, I think that every coaching course, whether it be a PFA coaching course or an FA coaching course, should have a required percentage of mental health awareness and training on coaching badges as well. So start at the other end as well.
Probably, we'll make this a last question, and then I'll ask the panel just for a sort of a one bullet point as a recommendation. So we'll go through.
It's not quite a question, actually. It's a couple of comments, if that's all right. I've enjoyed listening to all the speakers. My background is based part-time in football. I actually work as a consultant occupational physician half the time of my working week. So like Phillip, to some extent, I'm quite lucky in that I get an oversight of lots of different organisations, how their policies and practices work, and the interaction between health and work, public, private sector. I hope that will put some validity to some of the comments I'd like to make. The first, it's a shame she's gone, but I gave her the microphone for a reason. And before I ask the question, it's because we haven't actually touched on women's football at all, really, in any detail. Women have different needs, different psychology, different mindsets, and in this discussion, I feel that we must be very careful not to leave them behind in how we develop our strategies towards cultures, practices, individual treatment. That goes for both professional women's teams and the RTC. Certainly where I work in Sheffield United, I've been quite mindful with the people I've been working with to look at that as part of our organisational strategy. And that also helps the organisation become more cohesive towards this. I think we could probably summarise most of what's been said into two broad areas. One around organisational culture and practice, the other around individual level support. Both important, but I think that needs to be set out clearly in whatever strategy a club decides to employ. And that strategy needs to be consistent from club to club. Talked about the void between the first team and the academy. Mike's quite right. In the academy, it is easier to develop that structure because of the nature of the players being there for a couple of years. You've got consistent staff. And I think the 5 bullet points that you put up very neatly summarised what type of approach you can use. The only addition, I think, really to what you said was about the MDT. The discussion so far has been quite medical, and we need to be mindful that there are other people within the organisation who can help with this. I'll take, for example, the chaplain. HR can be very influential in developing organisational cultures. So the MDT, although I anticipate or understand what you meant by that, I don't think we should be using that phrase. It's a medical phrase. We need to expand that to look at other people in the organisation who can support this. So when players go from club to club, possibly on a 6-monthly basis or if they're on loan, they know what they're going to expect or roughly going to get when they go to each club in terms of support in this area. I feel that we talked about a tragedy being a motivator for change, and you're quite right. In my field, the main motivator for change is actually litigation. And we've seen evidence of in football where litigation has changed practice. I think it's a shame that we need to, or we feel that we need to wait for sufficient evidence to show that these issues affect performance and productivity, because there is plenty of evidence elsewhere to support that it does. And you'll know that because of the fields that you work in the city. I was at a talk by the head of occupational health and well-being from BT only a month ago, where he'd actually collected data on this to show to his senior management, if you address these issues in a systematic and consistent way, this is the benefit on your productivity. And he was able to demonstrate that in a graph. That's the kind of level of evidence we need, and we need people like yourself, Andy, to help support that. Sorry, no pressure. But I think you make a good start with getting the quotes and the comments. I really hope you take that further and you can start examining the organisational stresses which cause mental illness and poor well-being, both in staff and in players. Because if you can do that and get the and give us some advice around interventions, which will probably fall into one of 3 categories, our demand control or better reward or justice features, then I think we can move forward. And that's pretty much all I have to say.
Thanks, Bess.
Well said.
Thank you. I think what we'll probably try and do to sort of wrap up is to go through the panel here, and the whole point of the education that was provided today in the speeches was about taking action, because as we say, there's a lot of the fluff that's been mentioned previously. So what I would sort of ask the panel is, how would you take action? How would you tackle? Is there 1 or 2 bullet points that you would suggest that are worth from the audience and the other panel taking away that we can sort of act and work upon? So if we start sort of Phillip.
Yeah, I mean, I'll keep it short and simple. When I used to play rugby, there was a phrase, don't leave it in the dressing room. So it's great that you're all here, but we know behaviour change is all about doing something consistently, a small change over a kind of month period, leave here with one thing you're going to do. Maybe talk to some people at the club, people you know, people you work with, about mental health and about what you've heard today. Simple as that, no more.
I think mental health is everyone's business. And we often say that at all levels of the organisation, it has to be from the top, it has to be around leadership, it has to be about culture. But cultural change can be gradual, it can be quick. But the one change, the one conversation that you haven't had, that you've thought about having, is the one that might be important tomorrow.
I think for me, I've really enjoyed listening to people's views and engaging with people during the break as well. I think for what we have, the resources we have, just given from a club perspective, is we're doing as much as we can to support mental health. Conversations happen in the morning meetings around with the coaches, with the physio staff, with the medical staff. All staff are aware of mental health and raise it and support it. There's no hiding away from it at our club. But I've got a real push now. When I go back into work, I'm going to make an appointment with the chief executive, and I'm going to make sure this is put at board level. It's easy to sit here and say, I'd like it put in the next audit process. It's easy to say, I'd like an email to go round from FMPA to all the clubs that have been involved today, or wider, to say these are the things that are discussed. These are the action points we're suggesting at your club. Take Paul, thanks, I thought you spoke brilliantly. Can we get it at first team level? Can we get some support from for me, go back, speak to the chief executives, try and get board level, try and get first team level more engaged with it. And just, I think it's a drip feed process. If your club is not buying into mental health, if it's a weakness type of culture at yours, then it's a slow process. It's taken us years to get to where we are. I'm happy with where we are, but I don't think we're anywhere near to where we need to be. So thanks again to everyone for their input.
So for fear of being fluffy, I will just go back to what I said to Andy. And I will work with Andy, if he'll allow me to try and create something that's not centre of excellence, but examples of good practice in our sport that people can say, right, well, we need to copy that model because that's what seems to work.
I think what I take away really is that, this hasn't been said today, but I think there's too much turfism and competition within the area. I don't think one organisation within the industry has the power to resolve the work ahead. I think collaborative working and people working together is the only way forward. That's what I take from it.
And probably just for the reflection here, also that we'll probably never be happy with where we're at with this. It'll always be an issue, and we're always hopefully getting continuous improvement and working towards and getting better at it. I don't think we'll ever get to a stage where we say we've cracked this. I think if we can certainly make strides, and hopefully we are in a better place than where we are at the moment.
Well, as far as that's concerned, I mean, there's hopefully a lot of action points or ideas that you can take away to work with, whichever level of sport you're involved in, whether that's professional at the top level or amateur or even just, with family and friends. It's about raising that awareness of mental illness and being able to understand about what mental health involves, and there is a lot of support out there. It's about accessing the right support at the right time with the right sort of individuals. So I'd like to just thank the panel for coming and sharing all of their ideas and experience with us. I'll leave you with Eamon in a moment, but thank you very much for your time.